We're currently in Barbados' worst outbreak of COVID-19, and with it are more deaths than we've ever seen from the virus. What's worse is that for many families, they can't get the type of closure to which they're accustomed because of protocols that manage everything from how the bodies are handled to how many people can attend the services. A handful of loved ones have gathered to celebrate the lives of 66-year-old Rosalind Cumberbatch and her daughter, 47-year-old Kemar Cumberbatch, who died hours apart at the country's main COVID-19 isolation facility. Their caskets side by side on Monday at the Mile and a Quarter Seventh-day Adventist Church. There's no final glimpse for family and friends. The sealed caskets, a sign of the times, as stringent measures to contain the spread of the virus prevent corpses from being prepared for viewing. At the center of it all is Kemar Cumberbatch, who is grieving the loss of his mother and grandmother, a burden he's likely to carry well after the service is finished. Because of the grim realities of COVID-19, he was isolated from his loved ones, but they meant the world to him.
Them was my guardians. That was like my mother, my father. Like, you know what I mean. Them is like the people that teach me everything growing up. You know what I mean. It's always there for me. All these people that can defend me, make me feel safe. Like, so for me, it was tragic losing both of them at the same time because I feel like them is two closest people to me and my whole family. My mom had me at 16 when she was 16 years old. So like, you know, she was young. I mean, like, you could obviously tell my mom picture behind you, like, yeah, like me and my mom, cause she young, and then there'll be like you growing up with your kids as well. So when they reach a certain age, it's gonna be like we can start to bond different. You know, and my mom was like my sister to me as well too. You know what I mean? Somebody, people that we could talk about anything. We got a lot of conversations together. I mean, like, we had a different kind of bond. My grandmother's practically one of the strongest people I ever meet in my entire life. You know what I mean? Like, she's also a single mom. Had a very hard life. Probably had she first kid at 14. So, you know what I mean? You know, old time days. Working, can't field, pick cotton. I see my grandmother scale and bone 500 flying fish in a day. I mean, she do landscaping, all you got small, man. I want my work non-stop, you know what I mean? She take care of everybody, raised she 5 children, 3 boys, 2 girls, my mom being one of them.
Over the months of September and October, COVID-19 cases have increased more than 500% compared with August. New records in the number of cases recorded is almost a daily occurrence, and with it, more death. For Kemar, it all started in early September with his mother being hustled to the Queen Elizabeth Hospital, tested for COVID-19, and then being transferred to the country's main isolation facility after testing positive. A positive diagnosis of the virus immediately separates loved ones as they go into isolation for treatment, many fearing the worst case, that they may never get the chance to see their loved ones again. For Kemar, it was a nightmare.
At the end of the day, you cannot really be realistically telling somebody that you can't see somebody in their final moments and telling the person in their final moments that they can't see their loved ones as well. You know that you sick and probably in your heart or in your mind you telling yourself you might not make it. But you would just, one thing you would love to see, I would love to see my son if he lost. I would love to tell him what he going to tell him. I would love to let him know what he going to do when he pass away. My final, what we want, you know what I mean? My final wishes, my plans, like, mother, I don't even know if my mother in that box, if I could be realistic with you then. To just break it down that easy for you, to like layman terms, I don't even know if my mother inside that box because I ain't see inside of that box, I don't even know if her body in there. I don't even know if it's my mother that passed away because I ain't see she yet. If I can be really realistic about it, if you understand what I mean, because think about it, like, if anybody from your family dies and you was them next to kin, what is the first thing you have to do?
Identify.
Correct. Because when you identify the body, then the people can say, well, this is such and such. whatever the case may be. Was obviously that had a medical record because she in isolation or whatever the case may be, but I did not identify her.
Medical authorities have explained that the handling of deceased COVID patients is in line with strict infection and control prevention to protect loved ones and death care workers. Acting Chief Medical Officer Dr. Anton Bess acknowledged it's a difficult but unavoidable process.
COVID, you're still infectious. When you're dead, we want to protect the death care workers. So the standard procedures of infection prevention and control, wearing PPE, apply. What also applies to the management of a dead body is that autopsies are not done if the person has definitely died from COVID. The reason why autopsy is not done is because you may do something called aerosol generation, where you get the COVID-19 particles or virus particles in the air, and then that puts the death care workers at risk. So that's the most important thing that persons should appreciate.
Clinical psychologist Krista Celine notes that COVID-19 has upended the natural order of saying goodbye to loved ones. She said in cases similar to Kemar's, those left behind have to grapple with a range of emotions.
Extremely hard to manage. And so we are trying to find ways to help our clients. And, the technique that I use would be writing the eulogy, and then after the funeral, having an opportunity to go to the gravesite and say goodbye. But grief is complicated, and COVID-related deaths have complicated the way we grieve.
She suggests the provision of counseling for surviving relatives as part of the national COVID-19 response to help them cope.
Lots of people are also suffering from something called survivor's guilt, right? And, you may have had COVID and survived, and then, somebody else does not survive. Or in the example you gave, I'm here, but my family member is not. And so counseling also being extended to family members is an important addition to how we manage COVID.
Ian Griffith, the owner and funeral director of Earl's Funeral Home at Half Moon Fort St. Lucie, sees the pain of families firsthand and has been exploring the possibility of embalming victims of COVID-19 to facilitate ceremonies beyond closed caskets and cremations. It involves numerous changes that include the creation of airtight rooms inside the mortuary, rigorous sanitization, and the donning of full protective equipment from head to toe, with the ultimate aim of allowing families to grieve.
It was thought that these cases should be done and dealt with at one time, where the bodies are embalmed and dressed at the same time and casketed, which can be done. So when the body is casketed, after being dressed, the body is placed in the coffin, and the coffin of itself will be then have a sealed glass area where that families will then view the person through the glass. So even though the body is embalmed, which will be a safety factor from terms of the virus, is that we still want to take the precautions from an environmental perspective now, because you have family members coming, and we still, unknown factor of the virus, what can happen. Yes, all the chemicals that we use would actually kill the virus, but again, we are still in the unknown. So you don't take any precautions when it comes to the environmental aspect of it.
He revealed that his funeral home has already started making adjustments to seal the mortuary and filter the air leaving the room. But he warned that the transitional process for funeral homes should not be rushed, as the consequences could be deadly.
But then if you don't do the necessary things, you don't pay attention to the necessary protocols, then you find yourself having a situation where you can contract the virus. And unknowingly, sometimes you then turn around and pass it on to your family members. And then we're right now we're in a situation where we have community spread. And that is, sometimes persons are positive and don't even know it. And that's the problem we have here in Barbados right now.
The pain of death is real, and even more so with COVID. For Kemar and other affected families, the process of healing is only just beginning.